Hello friends, my name is Dr. Afzal and today is 29th of December 2020 and it's a Tuesday. Today's topic is very important. So many people ask me about reinfection. How many chances we have got to get the virus once more, how badly it can affect us and how we can prevent these reinfections. So this is a very important question and there has been a study which we are to talk in this video. Let's talk about that particular study. That study was conducted in Qatar. Qatar is a Middle Eastern country. It was done in 133,266 of those patients who were PCR positive for the COVID-19. Out of these many patients, 243 were those who tested positive for PCR even after 45 days. Why there was a criteria of the 45 days? Because scientists and doctors over in Qatar, they have seen that all those patients who came PCR positive within the 45-day period, they were most probably infected with the same virus in the same period, and these were probably the dead fragments of the coronavirus which were turning out positive as a PCR test. So they excluded all those patients who were within 45 days of their primary infection. Now, out of 243 patients, 54 were the cases who were very strongly suspected of having reinfection. And the median time for the second swab, which turned out to be PCR positive, was more than 45 days and less than 129 days. And the median time period was 64.5 days. Now, out of these 54 cases, 23 were symptomatic and they were detected PCR positive second time when they visited some clinic or some hospital emergencies. And out of 54, 31 were the patients who were asymptomatic and they were detected PCR positive during a routine screening or some sort of contact tracing. They had no symptom at all. During the studies, the doctors had seen that even those patients who had the symptoms, they had no serious symptoms. But the symptoms were mild and only one patient got admitted in the hospital and that was also discharged the next day. There wasn't even a single death. These studies were conducted by the researchers who were quite qualified, and these were done in the hospitals which were equipped with all the required equipments. So genome sequencing was done on these cases and it showed that only 4 of the total 133,266 patients, only 4 were the one who had shown that they were reinfected with another genome. That genome was D614G, because initially Qatar had D614 coronavirus like the rest of the world, but these 4 out of these 4, 3 were the one who were infected with the D614G. There was a replacement of amino acid aspartic acid at a position 614 by the glycine amino acid. So that strain was detected in the Qatar, but patients didn't have much symptoms and the overall risk to the life was minimal. Nobody died in the study, and the risk of reinfection was calculated to be 0.02%. That is a very small risk, and the conclusion of the study is that even though reinfection can happen, but it happens very rarely. It doesn't happen much, so that gives us an answer to the question which so many people ask us all the time. There is a risk of reinfection, but it will happen very rarely, and even if there is a case of reinfection, the chances of losing life or risk to life is minimal. So that gives us very important answer to the question. There is another very important update which I can give you, and that is from the Boston. A doctor over there, when he was injected with the Moderna vaccine, he developed allergic reaction. The doctor was already a known case of allergy to shellfish, and he was carrying the auto injector or the EpiPen which contains the epinephrine or adrenaline. The moment doctor realized that he is developing those symptoms like the dizziness, tachycardia, and he was about to faint, he had already discussed his case with the concerned authorities. So he immediately gave himself this injection of the epinephrine, and he recovered after that injection. So that is the first ever case of allergic reaction to a Moderna vaccine, because before that there were 5 cases of allergic reaction for the Pfizer vaccine, 1 in the Alaska and the 4 in the mainland. But only 1 was severe enough to retain in the hospital, and that also recovered later on. And there is another news from the Germany, where Pfizer vaccine was being given to the health workers in a care home, and 8 of the workers were given a doses which was 5 times higher than the normal dose. So they developed unusual flu symptoms. They were admitted in the hospital for monitoring purposes, and they recovered. It was an error on behalf of some health worker that they couldn't properly check, because that particular vials they contain 5 times higher dose of the Pfizer. So these are some updates. I'll keep on updating you guys. If you haven't subscribed the channel, please subscribe it. If you like the video, like it, and if you think it can help someone else, please share the video. Thank you so much for watching this video.